Hello, welcome to AdvancedMD's MACRA MIPS highlights of year 3 or 2019. We've got a lot to cover, so we're going to go ahead and get started. Thank you so much for being on time, and we will do our best to give you lots of information. We know that some of you have participated in MIPS before, and with the changes that some of you have probably never done this before. So we're going to try and cover content that will help both sides. So hang on, we've got a lot to cover. My name is Liz Smiley. I'm with the professional services team here at AdvancedMD. I've been with AdvancedMD for a very long time, and in the MACRA MIPS world, meaningful use, all of those things. So I'm really excited to share with you the things that we've learned from the 2019 final rule. Throughout, you may have questions you want to send to us. So just a quick review of how to do that. You will have this little go to webinar control panel. You'll click on this little arrow here. That opens up your panel. There's a section for questions. Type in your question and then hit send. Please, any questions or comments that you have throughout the webinar, we do have several members of the MACRA Posse, a group of us that are representing several departments within the company who work together to provide educational materials about MIPS to our clients. We've got several people monitoring the question box here, and they will try and answer as many questions as they possibly can during our webinar today. If they don't get to your question, don't worry. We are going to have a report with all the questions that are asked, and we'll be putting together a Q&A document, and we'll have that in Nest within the next week or so. So be watching for that. But please submit your questions when you have them so that they don't stop you from learning whatever it is I'm talking about next. So encourage questions. The next thing I would like you to do is practice that. Submit a question, or actually it's a submit an answer to me. It will help us when we are putting together materials and additional webinars. So if you could please let us know how much your office is doing for 2018 MIPS. So it could be we're only doing the negative. We're only trying to avoid the negative. We're going for as many points as we possibly can. We have no idea what we're doing. If you could take just a second and answer that, that would be incredibly helpful to us. Thank you. All right, this is what we're going to cover today. We're going to talk first about some definitions. CMS had some changes mid-year, so some of the terminology that they have been using might be a little confusing, so we're going to clear that up, hopefully at the beginning here. Then we're going to talk about who is required to participate in MIPS for 2019. Then we're going to go into each of the different categories and talk about the changes. The biggest change in the categories this year is the promoting interoperability, which is formerly ACI, but we'll also talk about changes in quality, improvement activities, and cost. We'll touch a little bit on attestation because, of course, it's the end of the year, 2018, and so we know that that's your next step if you have been participating in MIPS for 2018. And then we'll review your resources. At AdvancedMD, we try really hard to make sure that you have lots of resources available to you to help you with what you need to do for MIPS. So that's how we will finish, so that you'll be able to just leave this meeting and hopefully take some action steps if you need to. All right, some definitions. The biggest change mid-year happened because of a couple of regulatory things. There was the Bipartisan Budget Act of 2018, and there was also the Patients Over Paperwork initiative. And both of those helped open the door to some definition changes, also some procedural changes during the year, mid-year, instead of just waiting for the final rule to come out to make those changes. So promoting interoperability was one of the biggest changes. It used to be called ACI in 2017 and the beginning of 2018, but now they call it PI, or Promoting Interoperability. There could be some confusion for those of you who also participate in what used to be called Meaningful Use for Medicaid. CMS also changed the name of Meaningful Use for Medicaid to Promoting Interoperability. So just know that there could be some confusion for those of you who participate in both. When you're dealing with MIPS, Promoting Interoperability, it's one of the categories. When you are looking at Medicaid's program, the entire program that used to be called Meaningful Use is now called Promoting Interoperability. So hopefully that helps with some of the confusion around that particular term. They also changed what used to be called submission methods is now called Clinician Types. So that's dealing with your quality measures. If you do your quality measures through the EHR, for example, they are referring to those as ECQMs, which we have referred to them as ECQMs, but we've also referred to them as EHR measures. They are referring to what we used to call registry measures as CQMs or MIPS clinical quality measures. There's the Medicare Part B claims measures, and other collection types are like the QCDR, the CMS web interface, etc. Submitter type is what CMS is now referring to when they're talking about a clinician, a group, or a third party that is actually submitting the data. And then submission type is referring to the mechanism by which that data is submitted. So hopefully that will help you as you start looking through some of the materials from CMS to know what their new terms are. So let's get started. Got a lot to cover. MIPS 2019. We're going to cover first who's required to participate, and then we're going to talk about kind of the final score, an overview of the categories, etc. So let's get going with that. Since meaningful use started back in 2010, it has had the same clinician type requirements. So it's been the physicians, PAs, NPs, clinical nurse specialists, CRNAs. That's the group of the types of clinicians that they have required to participate. And this year, for 2019, they have added a whole new group. So I'm assuming that some of you are in this webinar today because you are one of these new clinician types. But starting in 2019, this is a new group that gets to participate. Clinical psychologists, physical therapists, occupational therapists, speech language pathologists, audiologists, and then registered dietitians or nutrition professionals. So if you are one of those clinician types or have those clinician types in your organization, please be aware that in the past you haven't had to even think about it, and now you do need to find out if you are required by CMS to participate. So these are the clinician types. The other part of who gets to participate is the low volume thresholds. So the low volume thresholds, there's 3 of them now. They did add a new one for 2019. So we have the first one, at least 90,000 in Medicare Part B allowed charges for covered professional services. So you need to do at least 90,000 to as the low volume threshold. If you do less than that, then you have not met that threshold. Another threshold is at least 200 Medicare Part B beneficiaries who receive covered professional services from you. The third one that they've added this year is at least 200 Medicare Part B covered professional services. We're assuming that they added this to help with those that tend to do like your clinical psychologist, your physical therapist, to help make it easier for them to figure out whether they're doing it or not. So these are the 3 low volume thresholds. Now the thing is that also added for 2019 is an opt-in option. So the rule there is if you exceed all 3 of these, so if you definitely do more than 90,000, you have more than 200 beneficiaries, you do more than 200 covered professional services, you must participate in MIPS. It's not a choice. Well, you can choose whether or not you're going to do anything about it, but then you'll be penalized if you don't turn in any data. So you want to exceed, if you exceed all 3, then you must participate. If you don't exceed any of them, then you don't get to participate. And new for this year, if you exceed at least one of these 3 thresholds, then you can opt in. And that's new in 2019. With the opt-in, it isn't a once you opt in, you are opted in forever. It's a once you opt in, you can opt in again that next year. And there isn't any registration process to show them that you want to opt in. You'll just start turning in data. So, of course, if you choose to do some quality measures by claims, that would be starting, in January when you're turning in your claims and you're turning in those codes on your claims. But if you are not sure whether or not you're going to participate, you're close to these thresholds, so you're really not sure yet what you're going to be doing, there are options for you. So that's new in 2019. The categories are the same as they have been for 2018. So we have our quality category, promoting interoperability, improvement activities, and our cost. For 2019, quality category is going to be 45%. So that's down by 5%. It's still 12 months, and it's still at least 6 quality measures. For promoting interoperability, it's 25%, like it has been in the past. This category has received the largest kind of overhaul, so we'll go into those details in just a minute. But it's 90 days, a 90 consecutive day period for attestation on that one. And there are 6 required performance measures starting in 2019. Improvement activities, it's 15% of your final score, just like it has been before. It's a 90-day consecutive period, and you'll choose between 1 and 4 activities depending on the size of your practice and how many you need to do to get that full 15%. For cost, CMS still calculates that. There is nothing that you need to do. It is a 12-month, so they start at January 1st and go to December 31st of that year. And this year they have added another measure. So it is 3 measures, and we'll talk about those details in just a second. But the categories are the same. The cost has gone up by 5%. The quality has gone down by 5%. But this is the total of your MIPS, your categories, your total score. So the biggest changes for 2019. You now need to have, for 2019, 30 points to avoid a negative. 2017, it was 3 points. 2018, it was 15 points. For 2019, it is 30 points. So no longer will you be able to do just one of the 4 categories. You're really going to need to up your game and participate in more if you are going to do just enough to avoid the negatives. How big of an adjustment? For 2019 final score, it will adjust your payments for Medicare in 2021, and those payment adjustments will range from -7% up to +7%. The exceptional performance bonus, you need to get at least 75 points to qualify for the exceptional performance bonus. And that one, the whole program itself was designed to be budget neutral. So those who are getting the negative adjustments, those negative adjustments are what pay the people who have worked to get some positive adjustments out of this. So as they move the minimum threshold that you need to avoid a negative, as they move that up, they are assuming that more people are going to be paying into the program, having negative adjustments to their payments. We don't know that for sure yet. A lot more people participated in 2017 than they were expecting. So typically, well, I talked to 2 people at our user conference who actually did get the full 4% for the MIPS adjustment from their 2017 performance, but the majority of people, even those that had a score in the mid-90s, they were getting about 2% of an increase, so anywhere between 0 and 2%. So if you are new to this and thinking, wow, 7% adjustment, they actually have a multiplying factor once they crunch all the data and figure out everything. And the adjustments that I've seen for 2019 coming in your 2021 payments, they're expecting it to be around 1.88 to be the high. So it says up to 7% adjustment, but that's not really what the reality is. So just be prepared for that. And as you're figuring out how much you want to participate, take that into account. All right, let's get into some of the changes for the categories. We're going to start, we normally start with quality because it's the biggest, but this year we're going to start with promoting interoperability because it's the biggest changes for this new year. First change is the name. So you may see still in a lot of materials ACI. We're in the process of changing everything to say promoting interoperability. Other places may take a little longer. So what used to be called ACI is now called PI, promoting interoperability. It's 90 consecutive days. So if you run the reports throughout the year and you find out that your summer rates are way better than your fall, you can turn in those 90 days that are the best days for your score. And that's actually what I would suggest you do. As the year goes through, just kind of keep an eye on how you're doing with your PI reports, with your activities there. Do what you can to improve your workflows so that you get a better score. It is 25% of your MIPS final score. So looking at it from the past, so those of you who are new to it, you can kind of ignore me for about 2 minutes, and that's okay. In 2017 and 2018, CMS found that this was very confusing. There was the base that had to be done. Some of the base measures were also performance measures. people were confused, and some people forgot to do the base or didn't do one part of the base, and so that knocked out, they weren't able to attest for this entire category. And so as part of that Patients Over Paperwork and the Bipartisan Budget Act, they kind of reinforced the goal of what this, how well you're using your EHR category is going to be. So the goal has been to simplify things. And so there was just too many little details that weren't really supporting that goal of promoting interoperability, promoting a good exchange of information between the parties involved, right? So you've got your patients, you've got you as clinicians, you've got those that you refer to, your pharmacies, and your other agencies, your public health agencies, your clinical data registries, for example. And there was a lot of other things that were required. So for 2019, what they've done, they've removed the base, they've removed the bonuses, and they have removed 4 of the measures. So you still have to do these for 2018. You've got another, I don't know, what day is this, the 6th? So you've still got another 25 days that you need to worry about these things. But after that, really, no more. No more patient-specific education in the reports. No more secure messaging in the reports. My favorite, no more view, download, transmit. Your patients no longer have to go to a specific part, click on a specific document in the right way in order to have that happen. So that is being removed. And then for those of you who were doing the 2015 measures, the patient-generated health data is also being removed. So base and bonuses are gone, and these 4 measures have been removed. So what's left? Let's look. So welcome to the PI pie. We're going to start with the slice of the pie that's the biggest, and that is there's 6 measures that you need to do. Remember, 6 required measures. A couple of things first that CMS is requiring that aren't official measures. So the first one is you must use a 2015 edition cert, certified EHR technology. You must use a 2015 edition cert like AdvancedMD. You must complete a security risk analysis. It used to be a measure. It's no longer on the measures list. So when you're looking on the measures list, don't forget you must do, just because you're submitting claims to Medicare, everyone is required to do a security risk analysis. You must do that. The security risk analysis, however, does not need to be done during the same 90 days as the rest of this category. It just needs to be done sometime during this calendar year. Okay? So on the measures lists, when you look at measures lists from CMS, you will not probably see security risk analysis, but it is required for this category. Don't forget it. That's why it's at the top of this. And that's why I'm talking about it first. Don't forget it. So now let's look at the 6 measures that are required. The first one, the biggest slice of the pie, is provide patients electronic access to their health information. So that's, are you giving your patients access with the patient portal? The next 2 in size deal with health information exchanges. So some of this is familiar. We've already been working with it in the past. One is electronically send health information to referrals. The other one is, are you receiving and incorporating health information from referrals? So the incorporate would be what used to be that clinical reconciliation, your medication reconciliation, those pieces and parts are that receive and incorporate. We'll talk a little bit more about that in just a second. We have our e-prescribing, and then we have the immunization registry, the public health registries, and our clinical data registries. So you will choose 2 of those. Now, one thing I want to point out here is exclusions are available for all of the 6 required except for the patient portal. Woohoo! So let's look at a couple of details more with this next slide. So there's basically the goals of promoting interoperability. Remember, there's your provider to patient. How is the information being exchanged there? Your health information exchange. How are providers talking to each other? How are clinicians talking to each other? How is that information going? The official title is Support Electronic Referral Loops by either sending or receiving. And then there's the public health and clinical data exchanges. So how are you exchanging data as needed and receiving data, or fetching data is the term that they're using. which allows you to go and get the immunization data, for example. How is that going? Are you in process of working out with those registries or agencies that you should, based on the kind of medicine that you practice, if you should be sending them data? And then your e-prescribing. So how well are you communicating with the pharmacies? So we've got our 6 measures that are required. And then in this, we also say, is there an exclusion available? What the maximum points are, and then how those points are going to be received. So your score, it's either going to be a performance rate, so how well did you do of all the patients that you should have set up with the portal, for example, how many did you get set up with the portal? For all of your transition of care appointments, so transition of care meaning that you are, receiving a referral or you are referring out, how many times with those kind of patients did you send electronic health information? Did you receive and incorporate health information? And that's going to be also based on a percentage performance. For the public health data, health agencies and clinical data exchanges, those are yes, meaning that if you are in process, if you can show that you are working with those agencies to either get started or you are in full, data exchange mode, if you are in that process, you will get to say yes, and you would get the full 5 points. You'll choose 2, and so 2 times 5 is 10. So there's 10 points for that category. With e-prescribing, that is going to be on a % of performance. So for all of the prescriptions that you should be e-prescribing, that you should be sending electronically to the pharmacy, how many are you actually doing that for? And that would be your % of performance on that. Notice that there's 2 bonuses available for 2019. This was added at the end of the year last year. Remember, this year. The final rule just came out. And so just know that most softwares are not already going to have something in place for these. Clients that I've talked to who are actually doing the query of the PDMPs with their state, just make sure you're documenting that, because these 2 bonuses are yes. So you could say, yes, I'm doing this. And as long as you have the documentation to show that, until CMS gives us the details of we want it done in this particular way, you will be able to claim points from what I've seen in the final rule and the CMS materials about the final rule. You should be able to have your documentation and be able to say yes, and know that one of the things that AdvancedMD is working on feverishly is to get these 2 things figured out so that they will be easily incorporated into your electronic health record workflow. At this point, they're not there yet, but it's just we're at the beginning of the year. So these 2 are bonuses, and for 2020, the proposition is that they would not be bonuses anymore. They would actually be required measures. But we'll see if that actually happens in next year's final rule. So we've got also that it's required security risk analysis. So these are the changes. It's only 6, and almost all of them have an exclusion available, meaning that if you don't do referrals, for example, if you are a specialist and you don't refer out, in the past, it's been less than 100. We have not seen those details yet. CMS is saying, hey, we'll have as many details posted as quickly as possible, which we have really no idea when that will be from CMS. But we're hoping, and if we all send positive energy to CMS, then hopefully they'll be able to do that faster. So that's PI, promoting interoperability. How well are you using your EHR? The next quality we're going to talk about is, the next category we're going to talk about is quality. It's 12 months, meaning that you need to start collecting data January 1st or January 2nd of this next year of 2019. It is 45% of your MIPS final score. So some details here. For those of you who have participated before, it looks very familiar. It looks very similar. There's just a few changes. One of the changes is that it's 45% of your final score instead of 50% of your final score. The other big change that I'm really excited about is this one right here. So because there's people who haven't done this before, for quality, you are to choose at least 6 quality measures. And you'll do what each quality measure has specifications that say we want you to do this particular thing with this particular group of patients. And so as you go through the year, you'll document that you did this particular thing with this particular kind of patient. And in the past 2 years, CMS's software wasn't ready to handle clinicians to really submit data in more than one kind of way. As of 2019, you will be able to submit via multiple collection types. That's the official language for this. So what that means is if you look through the list and you find 4 on the EHR list that are like, oh yeah, these totally fit my workflow. I already do this stuff. So yay, I can do these quality measures without really changing a whole lot because I'm already doing this. But that's 4 and you need at least 6. So then you can look at the list of claims-based, for example, and you can go, oh, look, here's 2 on the claims-based list. So the 4 and the 2, it gives me my 6. And so you are able to do multiple collection types starting in 2019. Huge, 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 huge. So excited about that. Yeah, really excited about that. So hopefully you guys are too. If you've not been able to find at least 6 that were really a good fit for your practice. You will earn points. So you'll earn between 1 and 10 points for each quality measure. And what determines how many points you get is data completeness and performance benchmarks. And we'll talk about that in just a second. But there's your 6, at least 6. And I say at least 6 because you get bonuses if you do extra things. So the bonuses that are available in 2019 for quality, if you do additional outcome and high priority measures, if you choose to do your quality measures in the EHR. So if you choose to do those ECQM measures, with AdvancedMD, use our advanced CQM module for reporting, and then turn in that report. You'll get a bonus point for each measure that you do that for. There's a bonus for improving in quality year over year. And then this is a big change. For those of you who have participated before, there used to be a small practice bonus of 5 points on your whole score, on your total MIPS score. But what they've done for 2019 is they've moved that underneath the quality category. And so it's now a small practice bonus in the quality category. That's where you'll get that. And so they're really encouraging small practices to make sure that you're doing quality, not just participating in, improvement activities and the ACI, now called PI, categories. So if you want that small practice bonus, you have to do at least 1 quality measure. And then what they'll do is they'll add 6 points to your quality numerator so that as this particular score, this calculation is being made, they'll actually add 6 points to the numerator, which can help you out quite a bit. So there's the only changes from previous years is that you'll be able to submit via multiple collection types, so like EHR and claims, to make up your 6, and that the small practice bonus is now here in the quality. So let's talk a little bit about data completeness. Data completeness for 2019, it's 60%. And what data completeness is that you are submitting the data for at least 60% of the patients who meet the criteria for that measure. So obviously, the sooner you start collecting data and turning it in if you're doing claims, because those you're turning in codes on your claims. And if you're doing ECQM, CQMs, QCDRs, then you're collecting that data. You'll report on it at the end of the year. But you're collecting that data and you'll be turning it in for at least 60% of the patients who meet the criteria for that measure. So you want to get started as soon as possible so that you make sure that you get this. If you get data completeness, then it opens up the possibility to earn up to 10 points per measure. If you do not meet data completeness, you will get 1 point for each measure that you do. Small practices, they have to try and encourage you still. Small practices will earn 3 points for measure even if you don't have data completeness. So for those of you who are new, small practices, according to CMS, is those practices that have 15 or fewer clinicians. Okay? So data completeness also take into account that it's different depending on the collection type. So if you are doing claims, that population, it's only looking at your Medicare Part B patients. So you would need data completeness. If you're doing claims, it's just looking at your Medicare Part B patients. It's not looking at your Medicare Advantage. It's looking at your Medicare Part B, your Railroad Medicare, and your Medicare as the secondary. Those are the three Medicares that it's looking at. If you're doing your EHR, your ECQMs, your CQMs, your QCDRs, it's all patients across all payers. Now, I know that for some of you, just this slide is probably giving you a headache, so just breathe, take a deep breath, and know that for some of the things with MIPS, it takes usually a few times to hear it before it makes sense. So if you're looking at this and it's complete Greek and you want to cry, don't. Just take a breath. You'll be okay. And know that we've got resources in Nest that can help you to understand this if it's not clear. So once we know that we have data completeness, then CMS is going to compare your scores to your peers. And so they have what they call benchmarks. The benchmarks for 2019 are not out yet. Okay, as of yesterday, I didn't check this morning. They usually come out around the middle of December. So I'm expecting to see them in the next couple of weeks. But the benchmarks for 2019, it will look similar to this. I'm betting that the column that in 2018 said submission method will probably say collection type, hopefully. But sometimes those kind of changes don't happen with CMS. But you'll have a benchmark, and so then you can find the one that you're looking for. You can find the measure that you're looking for, and it will have a line for if it's available to be submitted using claims. It'll have a line that tells you, hey, if you do this and you get this performance score, this is how many points between 3 and 10 that you'll get. So notice that this particular one, I've chosen one that shows a claims line, an EHR line, and a registry line, and how different those are. So that's something else you might want to take into account as you're choosing your quality measures. For diabetic eye exam, for example, because so many people that are supposed to do it, you have to get really, really good scores to get any points. Whereas medical attention for nephropathy, you could get, as low as 65% and get 3 points. You could get as, so take a look at that as you're doing it. And these are made up from your peers as CMS has been doing these. So there are some of the newer quality measures that won't even have benchmarks yet. If you choose one and it doesn't have benchmarks yet, that will be one where you'll get 3 points for that measure. All right, let's talk about improvement activities. Improvement activities hasn't changed a whole lot. It is 15% of your final score, and it is at least 90 consecutive days. It can be any 90 consecutive days during the year, and it can be the full year. In fact, some of the improvement activities are set up to be longer than just the 90 days. So we've got 2 different kinds of improvement activities that CMS lets you choose. There are high weight activities. Those are worth 20 points each. There are medium weight activities, and those are 10 points each. And for improvement activities category, you want to get 40 points. If you get 40 points, then you'll get the full 15% on your final score. For small, rural, or underserved, so remember small is 15 or fewer clinicians, small, rural, or underserved, you get to double your points. Woohoo! So you choose one high weight, it gives you 40 points, and you are done. So we are in the process right now at AdvancedMD. We've had improvement activities beginner guide. We've had that for you out on Nest, and we will be updating that to reflect the changes for 2019. So for 2019, there are 6 new improvement activities. They've added 6 new ones. They've modified 5, and that's usually where they just change the wording to make it more specific of what you really need to do. And then there's been 1 that's been removed. So we will be updating our materials, so you won't have to wait until CMS updates their search site. Last year that took a few months, and so if you want to get started on these now, we'll have our guide updated within the next few weeks for the 2019 changes, and we'll just be taking those directly from the final rule document that instead of waiting for them to show up on the list from CMS. So small practices, points are doubled, and you'll want to do then as many as you can to get 40 points. If you get more than 40 points, that doesn't help you. You don't get more than 15% of your final score. So 15 points toward the 100 needed for your final score is from improvement activities. You'll look through the list and guaranteed there are things you're already doing. So let me just put in a plug here for 2018. We're in December, so if you really have not done anything yet for 2018 and you're wanting to avoid a negative, remember it's 15 points to avoid a negative, 15% of your score, improvement activities. So you could probably look through the list of improvement activities for 2018 and you could find some of those that you have been doing. Just make sure that you document how you have been doing those things this year. And this is what you could do to avoid a negative for 2018. So just look through the list. If you haven't done anything yet and you are going to be zapped with a negative, for 2018, that would be a negative 5% on all of your payments in 2020 for Medicare. So this is the category that can save you for 2018. So highly recommend it. We'll probably we've got a thing out on Nest that says, hey, it's not too late. There's suggestions on there for some of the more common ones that we know that most of our clients participate in. They already do. It's a part of what you're already working on, just as a side effect of being in business. So improvement activities. Cost. Cost is one that CMS calculates. It's a 12-month performance period, and this year it accounts for 15% of your final score. There is a new measure this year. So in the past, they've gone with they calculate based on your Medicare spending per beneficiary, your total per capita cost. And for this year, they're adding 8 episode-based measures. In the past, we haven't had a whole lot of information from CMS on cost. So we're going to be digging in and finding what we can. And we'll have a cost beginner's guide at the beginning of the year to give you a little more information about these new parts. But CMS calculates it for you. It's based on the claims that are submitted and on the information that they have about your Medicare beneficiaries. So they crunch all of that data together and come up with these 3 numbers. And if you don't have enough for one of these in particular, then they'll base it on the other 2 or the other one, whichever one you do qualify for. So a quick review of what we've covered so far. The biggest changes. We've got huge changes in promoting interoperability. They've made it a lot more simple. There's only 6 required performance measures now. And the biggest changes are 30 points are going to be needed for your score. And it's a -7 to +7 in your adjustments. So those are the biggest things that have changed for 2019. Let's talk really quickly about MIPS for 2018. So it's the end of the year. You're coming up to that point where you need to do take some action. So we are going to talk about EIDM user really quick. You need to get it done now if you have not done it yet. The attestation deadline is March 31st, 2019. Now the past 2 years, they have extended that a few days in March. I wouldn't count on that, but just know that the closer you get to March 31st, the more problems there are going to be with the websites that you need to deal with. So put it on your calendar to get it done, end of January, beginning of February, get it off your plate, have it done. That should be the goal. We at AdvancedMD will be putting together some attestation information as soon as CMS releases what it's going to look like. We're assuming it's going to be very similar to what it was last year, but we don't know for sure until we're able to get access to that. So we will be putting together materials and have it on Nest as quickly as we possibly can at the beginning of January to help those of you who do want to be proactive and get it done much earlier than the deadline. So the first part of that is an EIDM user. So you need to do one of 2 things. First one, if you have done EIDM before, then just sign into that CMS website. So on the QPP.CMS.GOV, go to that upper right corner, sign in, and just make sure that everything is happy. When you log in, make sure you can log in, and then that on your dashboard there, that every person that's supposed to be associated, every clinician that's supposed to be tied to your login is there. All of those things are happy. So if you've done it before, then do the right side of the screen. If you have no idea what I'm talking about and you've not done this before, then you want to, or if you try and log in and it says that your EIDM account has expired, then you're going to want to go through these steps. And with the, there's a really, really great guide that CMS has put together that's on their QPP.CMS.GOV website. Scroll down, it's toward the bottom. I'll show you in just a second where you can find that. But it gives you the things that you need to do. So for MIPS, you're going to choose, when you go to the website for user registration, you're going to choose PV, Physician Quality and Value Programs. It would be nice if for MIPS it said choose MIPS, but for some reason for MIPS, you're going to choose this. And then the information that you're going to need to have, clinician's name, legal business, all of those details, have those with you. And then the part that takes the longest is you're going to be setting up approvals and roles. And depending on how things go there, that can take some time. Even have to mail, like through snail mail documents. So it can take some time. So please, please, please start this. Like, this is your action item. If you have not done this, do this right after this call if you possibly can. Get this going now. This website went down a lot last March, a lot. Stopped a couple people from being able to attest. So please don't let that happen to you. Do this now. Now. Do it now. Well, finish this webinar first and then do it. Okay. All right. So key deadlines, March 31st. We plan to have some materials for you available in January as soon as we've seen what CMS is doing. But again, the sooner that you start, the more time you'll have to solve any problems. Hopefully you won't have any problems. Many people don't have any problems. But if you are one of the few that will have problems, it's better that you have more time to get those solved, to get the right people involved to help you solve those problems. So let's talk about your resources. So we've got fabulous resources with CMS, and I've noticed over the past 2 years they have been listening to feedback. So please, if you are on their website and you want to, you're like, oh, I think this should be better this way, please submit that data. Or I've got questions about this. The way that you wrote this, I don't understand it. Please submit that feedback because they are listening and their materials are getting better and better every year. And they're getting better and better throughout the year. So as I've been looking through the final rule, there are some questions that I have that I've written down that are not clear to me. And so as CMS, they have webinars throughout the year. And those particular questions that are not very clear or specific, now they usually do get more clear and more specific as the year goes through. So don't just look at 2019 at the very beginning of the year and figure that, you know, there's nothing that's going to change during the year. This website here will change a lot during the year. It changed a ton during 2018. So some key points. So it's QPP.CMS.GOV. I would suggest you mark it. If you are participating in MIPS, I would suggest you mark this as a favorite in your browser. You'll scroll down the page, and this is where you'll see that EIDM account guide. This will help you with the step-by-step things that you need to do to get your EIDM credentials set up. Okay? Really good guide. Really, really good guide. Highly recommend you do this. There is also a link here if you are a small, underserved, or rural practice. And of course, those are not criteria. That's not the right word. Can't think of the word. Sorry. It's a grouping that CMS gives you. You don't get to decide that you're serving an underserved. CMS, based on who you are, where you are, what you do, they will determine that about your practice. But there are extra resources for you that have been paid to help you. So if you are in one of these groups, small, underserved, or you're a rural practice, please access those. They're paid for. They're free for you. So please, please go here, get to know the people that are, it's usually state specific, so get to know the people in your state that can help you. And then this one right here, this one that says, you know, see more references. This is one of the ways that you can get to the library, which has all kinds of really good resources. When the benchmarks for quality come out, they'll be in the quality section, but they'll also be in the library. And then the other part of the website that I would suggest you go to, so up at the top, they've got this MIPS, APMs, About, and Sign In. The MIPS section, you can open that and then go to Check Participation Status. CMS has not yet updated it for 2019, but they have said in the last webinar that they are hoping to get that up as quickly as they can. Again, don't know what that means, But if you are not sure if you are going to be required to participate in 2019 or not, then I would suggest checking your participation status often until that 2019 data comes up and you can actually see, what they consider, if they can think that you need to participate or not. And then this is also where you can explore all the measures. Now, there's not a lot of changes in the measures between 2018 and 2019. So if you've never done this before, you can go here now, see the ones for 2018, look at them to kind of get an idea of what you might be wanting to do in 2019. And another resource, they have resources, whether you're primary care, small practices, large practices, or free technical support. These organizations have all been paid for. They've gotten their money, they're set up, they are ready to help you. So this just came from the website on CMS.QPP.gov, QPP.CMS.GOV, and they're there. They're ready to help you. So please use them. And then, of course, AdvancedMD, we have lots of resources available to you. We've got our software, our help files. We've got lots of things on Nest. I know that I've been referring to Nest throughout this entire thing. It's our user community, and that's where we put the majority of our materials. If you have things that you're like, oh, I wish you had one of these, please submit that as a question during this webinar, or go ahead and submit it on Nest. But and we will do our best to give you the things that you need. Now, if during this presentation you're new to this, or maybe you've tried it before and you just have not gotten what you need to get going in your MIPS workflows, we do also have professional services. That's a team I get to work with the MIPS consultants, and we provide consulting and monitoring packages. So with the consulting packages, you get to meet with a MIPS consultant who has received 20 to 40 extra hours of training in MIPS. They go through a lot of extra training, and so they will help you develop what your MIPS workflow would be, and get those things into your key that you need to have success with MIPS in 2019. And if you do the monitoring, we actually do monthly reports that combine AdvancedMD's normal reports with additional data from CMS. So you don't have to go through all the stuff at CMS to try and find the data. We add that to you to kind of help you get a better idea of where you really are and what you can do to improve. So we've got lots of resources for you with AdvancedMD. So a couple more things before we go to the questions that have been submitted until we run out of time. I have a question for you. So if you could open up your little question area and please answer me, what were you hoping to learn today about MIPS that wasn't covered? There's a lot to cover, and we have a limited amount of time. And so if there are several things that people mention, we can put together another webinar. No problem whatsoever. We can also, if it's shorter topics, we can do some training videos. We can make sure that you get the answers to the topics that you are most interested in. So please take a second and answer, what were you hoping to learn today that wasn't covered? And like I've said at the beginning, we'll be going through all the questions that are submitted during this webinar, and we will be putting together a document and getting all those answers to you, so that if you are not one who likes to answer pose questions during things like this, you'll get to hear what other people asked and get their answers. So everyone will get to learn. And the last question I have for you would be what topics, any topics, so MIPS related or not MIPS related, anything related to your business that AdvancedMD can help with. So what topics would be most helpful to you for future webinars? So, we're in the process of planning things for next year. And so this would help those people who put together the webinars that we have.
Thanks, Liz. Yeah, lots of great questions coming in today, so thank you, everyone. One of the first questions was from Dr. Perry. He says, with the quality letting us submit measures in multiple ways, if I turn in one measure 2 different ways, both through the EHR and claims, will that count as 2 of my 6 measures since they are looking at different populations? How does that really work with my score?
Okay, good question. And let's clear that up from the beginning. So you want to have 6 different measures. So you could, CMS will let you turn in one measure multiple ways. But that doesn't mean that you get to count that measure multiple times. So each measure that you do is just counting as one of the 6. So for example, let's put a name to some of these. So you could do the BMI, for example, that you're monitoring the BMI, and if it's high, you do something about it, or low, you do something about it. You could be turning in that data maybe with EHR and maybe with claims. That doesn't mean you get to count that twice, but what CMS will do is when you turn in all 6 or more, because remember, if you turn in more, you get bonuses, depending on what you're looking at. If those additional ones are the high priority or the outcome measures. If you turn in by multiple collection types, CMS will actually look at that and they'll give you the higher score. So if you had a higher score when they look at the population for claims, so if they're only looking at your Medicare population and you got a higher score with that one, then they would count that one and they would just not look at the data that you turned in. Well, they'll always look at all the data you turn in, I mean, let's be honest, but it wouldn't affect your score. They will give you the higher score when you turn it in via multiple collection types.
Okay, great, thanks. Julie and Ginny online had asked this question. If I see both Medicare and Medicaid patients, am I required to participate in both MIPS and meaningful use?
Okay, another good question. We get this one a lot, and with Medicaid's meaningful use, which is now called Promoting Interoperability, that you had to start that program. The last year you could start working with Medicaid meaningful use was 2016. So if you have been participating since then, yes, you still would. And if your population is such that you are serving Medicaid population and Medicare population, then yes, you would be, you'll want to log in to the CMS website and double check and make sure that your thresholds, that you are above those thresholds to participate and are required to do the MIPS. And if you are, then yes, you could be participating in both programs.
Perfect. Okay, another very popular question today is, I'm not sure if I have to participate in 2019 or not. I keep checking the QPP web participation status and it's still not available. As well as there's other questions that I've seen online from different people on whether their specialty or if they need to participate this year.
Okay, so with the whether or not you're going to need to participate, things that I would suggest that you do now, CMS they've said that they're going to update that place. So let me just kind of pop back to that. So you'll go to the QPP.CMS.GOV, MIPS, check participation status. You'll put in your individual NPI and it will come up. And in this year, right now, it has a tab for 2017, a tab for 2018. So you're looking for that tab for 2019 is what you're looking for. Don't know when that will be becoming available. So in this small, underserved, and rural practices, there actually, when you click on that, there's a state map. So you can click on that state map and see what organization has been set up to help you in your state. You can contact them and see if they have access to that data yet, because I'm betting that CMS has access to the data. They just haven't formulated it in a way that it's available on the website yet. So you could check with that organization. Also, if you've been using AdvancedMD, then you could go to the PM side and you could run some reports like your analysis of services report. You could run to see how many beneficiaries you have in your Medicare and see how close you are. Most people aren't real close. They're either not even close or they're way above those thresholds. So hopefully that helps you to do some determination until CMS is kind of caught up.
Yes, great. Thank you. There's also a couple other ones here. Lori asked, can we use the same quality measures and improvement activities in 2018 that we used this year? I mean, in 2019, can we keep using the same ones over and over again?
Depends. So let me start with the quality measures. With quality measures, there's a few that CMS has removed. Most of those are ones that they call topped out, meaning that it's just a part of their natural workflow now for most clinicians. So they've decided not to give you points to do those. So they've removed a few. So you just want to make sure that there's the ones that you want to do haven't been one of the ones that's been removed. Same thing with improvement activities. When you're looking at improvement activities, you want to make sure that the details of that improvement activity, there are some of them that say you can only do this once every 4 years, or you can only do this once every other year, or those kind of details. So as long as those details aren't in the improvement activity you want to do, you could do the same one. You just want to make sure that you document it well, that you actually are continuing to improve whatever that activity is that you've chosen.
Great. Perfect. So Brett also asked, for 2019, CMS is requiring a 2015 certified. My software company hasn't gotten there yet. Do you know if we can still do our quality measures through the EHR there? Or does that have to be part of the 2015 certification as well?
Good question. With what CMS has said is that they are requiring the 2015 cert. So if you are doing EHR quality measures, they have to be done using a software that is 2015 edition certified. So you would need to change to not be doing your EHR. You'd need to change your EHR qualities to maybe doing ones that are claims-based. If you are that, or come to a software that is 2015 certified, like AdvancedMD.
Perfect. Okay. Another one is, I had one from Dr. Mahdi that asked, is it true that my CMS will publish my scores for MIPS for the whole world to see?
That is true, yes. Something that's not talked about very often. CMS has a program called Physician Compare, and they actually, I think right now we're in a, quote, feedback period for Physician Compare. So you can look on the CMS website, do a search for Physician Compare, but they're not releasing like scores. They've got stars or smiley faces, or I haven't seen it yet because it's in the feedback period. But yes, your scores will be released. You'll basically, so that patients can compare you with your peers. And so if you get a higher score, so that is one reason why some people are not just doing MIPS to avoid a negative, because you will be compared. And for patients, they don't know what MIPS is unless you explain it to them, and why would you? They don't know what it is. So for them, participating, if some other doctor in your area gets a better score, then that might not reflect as good as well as it could. So yeah, it is something to be aware of. And as soon as it's been released, and we can grab some screenshots, we'll go ahead and put together a little one-page about it on Nest.
Okay, this will be the last question then. So our Dr. Nielsen asks, our office has only done the minimums before, but we are planning to get going with the quality category for 2019, but we're not quite there yet. This one is supposed to start on January 1st. If we aren't ready by that point, how will that affect our score?
Okay, yay on deciding to participate more with MIPS than you have in the past. Remember that data completeness, so that's 60%. So if you are just kind of ramping up for the first month or two of the year, your score is not going to be as good as it could be if you started, directly on January 2nd, but definitely get started. And you will you'll get the quality scores. There's ranges on those, so definitely do what you can to start those quality measures.
Perfect. Thanks, Liz.
Yay.
We'll be working on getting all your other questions answered for you, as well as you'll be receiving an email with a recorded version of this webinar. So we appreciate everyone joining us today. Thank you, Liz.
Thank you. And just one plug, please, if you are a Facebook user, follow us on Facebook. I know that the person who works on that particular project is always posting things. I think there's MACRA Monday. So we try and keep you up to date, not just on things related from AdvancedMD, but things from, everything health related. So there's all kinds of interesting articles and links that are posted there. So if you are not yet following us on Facebook, please go ahead and pop over there and do that. So 2 things, EIDM, go get your EIDM user and go ahead and follow us on Facebook. Thank you so much, and we'll chat with you at the next webinar.